All right, we'll keep rolling. Chapter 20, face and related structures. All right, so we talked about frontal bone, zygomatic bone, and then maxillary bone to make up that orbital margin. Frontal, okay, think forehead, nasal bone makes up the nose, the top part basically between the eyes. Maxillary is your cheek, mandible is your jaw, okay? Sphenoid to the side. The zygoma or zygomatic arch is just this curve. And then our TMJ, temporomandibular joint, that's where our mandible sits and meets our temporal. So if you feel on your jaw and open and close your mouth, you'll feel where that TMJ moves. And we'll talk about some specific conditions with that TMJ. Okay, so right in here would be our TMJ. Now, it is a synovial joint, meaning it's mobile. This allows for the process of mastication. Mastication is chewing of food. And if we have a malocclusion of the TMJ, that just means that the joint does not line up right. And this is actually, I was at a conference a couple years ago that talked about TMJ issues, and this was the most common underdiagnosed or underreported orthopedic injury in the entire body. So out of all joints in the entire body, TMJ is number one. However, we just don't see it. People don't complain of it. They just, if they have a malocclusion, they just think it's part of life. They go about it. It's not like elbow pain or knee pain or hip pain. They just kind of deal with it. So something to kind of think about with TMJ. Now with the ear, we're not going to dive in super deep. External, middle, and inner. Okay, external, we have the auricle, otherwise known as the pinna. That's the cartilage. Okay. The EAM, external auditory meatus, that's the chunk of cartilage that covers the ear canal. Middle ear is where we have the malleus, the incus, and the stapes. Okay? So those are the three, that's the eardrum. And then the inner ear, that is where we signal those, or we transmit those signals to go down into the ear, and then the rest of the brain and nervous system can make sense. So external ear gathers the sound, middle ear transmits. We have our three bones in that middle ear, causes vibrations, moves things around, moves the fluid, and in our inner ear transmits those signals. They've gone from a physical signal, so those vibrations have been transmitted to a nerve, and then in that inner ear is where we have that understanding of what we're actually hearing. So a very convoluted process. Just be aware, external, middle, and inner, and kind of know in general what they do. Now in the inner ear is where we find the cochlea and the semicircular canals. This is balance. Okay, we'll talk about this when we get to concussions and the vestibulo-oculomotor reflex, but our inner ear is also responsible for balance. So it helps get our sense in space, our sense in the body, let us know where we're at. And it's basically just transmission of fluids. There's also what they call rocks in here, and they can become loose, or they can become free floating, and that can throw off your balance. And so there's a lot of different forces at play within that inner ear. The nose, we have our nasal bone, and the rest is all cartilage. You can see the cartilage is not all just one chunk. There's several pieces. The middle, the division, is the septum. Here we have the throat, okay, your larynx, aka the voice box, covered by your thyroid and cricoid cartilage, moves up and down. We can see the muscles that surround the throat, protect not just the larynx itself, but also the trachea. In the mouth, okay, we have our lips, where your lips meet the rest of your skin. Okay, so that color change and the reason your lips are red, that is the closest area in the body of blood flow. So that's why your lips are red, because the arteries are that close to the surface. We call where your lips meet the rest of your skin, so that color change, that's the vermilion border. Tonsils in the back, tongue at the base. Lingual frenulum is that base of tissue that connects your tongue to the floor of your mouth. Then we have the teeth, and the gingiva are the gums. For the tooth, just be aware, like an iceberg, we see the crown, but most of the tooth is the root, okay, which is hidden, is underneath. So just know this left-hand column, don't worry about the right. You have 32 teeth, okay, upper and lower rows. Hopefully you have 32 teeth, surrounded by enamel. Enamel can wear away over time. It can become yellow. It can become stained. The neck sits within the gums, and the root serves as a strong, strong anchor. All right, the ear. As we mentioned, that auricle, you can actually have some bruising or some discoloration with a blow. Most important thing I want you to take away is the battle sign, okay? Battle sign is bruising or discoloration right behind the ear. That indicates head trauma. The other thing to think about around the ear, this periauricular area, are enlarged lymph nodes, usually down here, right at the base, kind of your skull, right where we go from bone right in here to more of a soft tissue. If you feel those lymph nodes, that might just mean you're getting sick. It could indicate some other conditions. When we examine the ear, we use an otoscope. Okay, so that's our tool to examine the ear. When we're all back together, I'll have the otoscope and we can check things out. We can also use the otoscope to examine the nose. Things specifically to pay attention to with the nose, epistaxis is a nosebleed. Okay, so fancy name for a nosebleed is epistaxis. Inspection of the mouth. Okay, you always want to look for teeth, any bleeding of the mouth, any cuts on the tongue, cuts in the lips, cuts in that vermilion border. Again, just kind of checking, making sure everything looks normal. Here we can see a great slide with all the different palpations. So take a moment, go through those on yourself. Next slide as well, you can see the different muscles. Temporalis, okay, right around your temples. And then masseter and buccinator. Masseter helps move your jaw up and down. Buccinator moves side to side. So it helps us, masseter and buccinator helps us chew. Test for the ear. Any hearing loss greater than an hour needs to refer. Balance issues also show potential problems with the ear, such as an inner ear infection. Nose, have them smell. I always try and keep like a pack of gum on me. Have them smell that, peppermint, mint, whatever it is. And then TMJ involvement, have them open and close their mouth. Lateral excursion is moving their jaw side to side. And the knuckle test, have them take 2 fingers, okay, or bend 2 fingers and then have them bite on their knuckles. You should be able, everybody should be naturally able to get 2 knuckles within their mouth. If they can't open their jaw wide enough, they need to be seen for a TMJ issue. All right, now we're going to start some common eye, nose, throat injuries. First up, cauliflower ear. Think wrestlers. Okay, we can drain it, we can cast it. Typically goes away if we catch it early within the first 24, 48 hours. Anything longer than that, it starts to calcify. For some wrestlers, it's seen as a sign of, or a badge of honor. Tympanic membrane rupture. Okay, so sudden change in air pressure or direct trauma. Think using a Q-tip, going too deep into the ear, or perhaps a middle ear infection. What happens is the tympanic membrane, okay, so when that middle ear gets red, gets irritated, gets swollen, it can actually cause for a full tear. You can actually lose air. And there we can see, so through an otoscope, normally this should be nice and bright, nice and clear. With a tympanic membrane rupture, it's going to be red, irritated, swollen, pretty gnarly looking. Otitis externa. Okay, otitis tells us we're in ear country. That's just an infection of that external ear canal. Swimmer's ear, Fungus grows in damp, dark conditions, which is exactly what that ear canal is. Very, very common, especially in kids. Sometimes when you see kids pulling on their ear, like with babies or kids that can't talk, like Gus's age, which, by the way, look at that little guy. He's simultaneously 18 months, but also 80. But if he were to pull on his ear, that is kind of a hallmark sign that it might have an ear infection. Typically resolves on its own, though, although you can get eardrops. Otitis media is infection of the mucous membrane, so this is deeper within the ear. Very, very common with an upper respiratory infection. Okay, and then treatment is just antibiotics. Nasal fractures, most common fracture of the face and skull. Signs and symptoms, massive, massive bleeding. Okay, they're going to have a deformity and massive amounts of bleeding. So with that, we want to control the bleeding. Squeeze, pinch the nose, tilt forward. Don't have them look back. You can use gauze. You can plug the nose. You can also put gauze between their top lip and gums. That puts pressure, helps to slow that blood flow to the nose. With a suspected nasal fracture, always, always, always stop the bleeding first, then try and look for the fracture. If they have that deviation or breathing difficulty, immediately refer. Otherwise, they can be seen the next day. And typically, most physicians won't actually reduce until 5 to 10 days after. So there's what I mean by that deviation. Throat injuries. We want to correct no deviations, immediately refer. Biggest thing, they're going to have a raspiness, squeakiness potentially if they try and talk. You want to get them calmed down. You want to try and calm the situation because they're going to have difficulty breathing. And the more they're stressed, the worse it will get. Facial fractures, we can have mandibular fractures, so the upper jaw or around the jaw, bleeding around teeth. Think getting kicked, getting hit with like a bat or another object. The tongue blade test, you have them bite down with a tongue depressor, and then you try and twist the blade or twist the tongue depressor. If you can twist and pop their jaw open, that's a positive jaw fracture. Other facial fractures, anytime we have swelling, anytime we have tenderness or crepitus within the jaw or a flattened cheek, just refer. Facial fractures, very common. Anytime you have crepitus, anytime you have swelling, anytime you have pain to the face, it's more than likely going to be a facial fracture. So always CYA. TMJ, wide range of injuries, as you can see. Many of us can grind our teeth at night and not even know it, but there's a lot of different issues. But if you're dealing with someone that has chronic headaches or neck pain, don't rule out TMJ dysfunction. TMJ dislocation, I'll post a video so you can see where the jaw actually dislocates. Pretty cool to see, but the jaw basically just gets stuck. With dental injuries, you can have tooth fractures or fracture of the enamel. With our tooth injuries, we want to refer to a dentist. Typically, you have about 12 hours. Sometimes 6 to 12 hours or more of the window, but usually up to 12 hours to get them seen. Always sooner the better. Here you can see some specific fractures of the tooth, or the tooth actually pops out. If it's loose, leave it in place. If it actually does come out, if it does totally luxate, which is to become removed, try and find some saline, put it in a cup, store it in some Tupperware, but try and keep the tooth, get that clean. We don't want to scrub it, but we want to try and get them seen to the dentist as soon as possible. And here's just some good emergency management of the tooth. Again, don't scrape, just try and rinse off. And then some other ideas for on-field management I'll let you read through. But basically, very similar to the eye. for some of our main injuries, main conditions. If you see those, recognize them.